As you may already know, chemotherapy refers to the use of drugs to fight cancer. Normal healthy cells divide and grow in a controlled manner. Cancer cells, on the other hand, divide quickly and grow out of control. Chemotherapy drugs, also known as anti-cancer drugs, attack cells as they are dividing. This means that anti-cancer drugs also affect any type of cells that divide quickly, for example, blood cells and hair follicle cells. Your chemotherapy prescription, or regimen, may be a single drug or involve a combination of 2 or more drugs. Chemotherapy drugs are often given in combination so that they can destroy cancer cells at different stages of their life cycle, giving us better results. Your chemotherapy prescription will be chosen based on the type of cancer you have and how far advanced it is. Through research and experience, scientists have learned that one particular regimen is most effective for each type of cancer.
We have already mentioned that chemotherapy attacks cancer cells and can also affect healthy cells. Chemotherapy is usually given in cycles or repeated doses, separated by rest periods so the body can recover between treatments. If your body does not recover during the rest period, your next chemotherapy treatment may be delayed, or the dose may be reduced to allow your body to recover. Treatment delays or dose reductions are usually the result of conditions such as anemia, thrombocytopenia, or neutropenia, which occur when chemotherapy reduces the number of certain types of blood cells. Anemia is a reduction in the number of red blood cells. Decreased red blood cells can lead to fatigue. Thrombocytopenia is a reduction in the number of platelets, the blood cells that are essential to clotting. Fewer platelets can lead to bleeding or bruising. Neutropenia is a reduction in the number of white blood cells. Decreased white blood cells may lead to you getting an infection more easily, or you may have more difficulty in fighting infections. This may all seem a bit overwhelming or frightening, but don't worry, these problems can be prevented or treated. That is something we cover in the next section.
Working together, you and your healthcare team can minimize the chance of delay in chemotherapy and dose reductions by monitoring your condition. Pay close attention to your health, and when necessary, make use of medical treatment. Your healthcare team will check your red blood cell count regularly to see if you're at risk of anemia. You can help by reporting symptoms of anemia, such as feeling unusually tired, dizzy, or short of breath. If you do develop anemia, there are treatments that can help, including a diet high in nutrient-rich foods and blood transfusions. If you develop thrombocytopenia, you can avoid the bruising or bleeding that may occur by simply being careful. Use electric razors so you don't cut yourself. Avoid activities that may cause injury. And make sure that your healthcare team knows all medications that you're taking, so you don't accidentally take drugs that could lower the number of platelets in your blood. If you develop neutropenia, any infection can become quite serious because your body's ability to defend itself is compromised. To avoid infection, take simple steps like washing your hands often and avoiding sources of infection like crowds, sick people, undercooked meat, cat litter boxes, and bird cages. It is very important that you pay attention to your health and report any possible signs of infection immediately to your healthcare team. These signs include fever, flu-like symptoms, nausea and vomiting, diarrhea, shaking chills, headache, or neck stiffness. If you develop infection, your healthcare team will make sure that your infection is treated and may give you treatment for your neutropenia as well.
When you fight cancer, you are not alone. Your healthcare team will be there to help you with every step of your chemotherapy journey. Who exactly are the people who will make up your healthcare team? Your oncologist is a cancer specialist, the person who helps you make the decision of what type of chemotherapy you need. If you have leukemia or another cancer of the blood, you will see a hematologist instead. Your nurse either works closely with the oncologist or administers your treatment and is probably the person you will see most often. If you have concerns and don't know who else to ask, talk to your nurse. Your pharmacist is the expert on drugs and a good person to talk to about the medication side effects. Your drug reimbursement specialist is specifically trained to work closely with your pharmacist to find alternative methods of funding for non-funded chemotherapy drugs. A social worker can provide you with counseling to help you cope with stress and emotional issues. Your dietitian can give you advice on how to eat well while you are going through chemotherapy. And your spiritual care specialist will offer you empathetic listening, support, and consultation, and with you will navigate the path of difficult or ethical decisions regarding the choice of treatment. Don't be afraid to ask questions. Keep a notebook to write down questions when you think of them, and record the answers so you don't forget. If you are embarrassed, confused, or afraid, say so. Your team is there to help.